Hello everyone, welcome to Pediatrics for Dr. Anand. This is the Unacademy NEET PG platform, and today's topic of choice is nothing but like our FMG results are out. Our mind-blowing FMG results are out. So what is our next approach? So hello everyone, this is Dr. Anand, and today we're gonna talk about how well we can study for the further exams for FMG. What are the do's? What are the don'ts? What is the things we should be stressing on, and what is the thing we should not be stressing on? So for the newcomers, you all know that my name is Dr. Anand Bhatia, and this is the Unacademy NEET PG platform. In the Unacademy, you have Plus subscription view and you have Iconic subscription. In the Plus subscription of Unacademy, you all know that you get the access to all the amazing live and recorded classes. You get to study from the best of the best educators all over in the India, and also at the same time you get to participate in various tests and quizzes. हाय संधू संधू व्हाट्सअप क्या कर रहे हो आप यहाँ पे दोपहर के 3:30 बजे हैं and you get to study. You get to watch me on your iOS, on your Android, and on your laptop also. This is the Plus subscription. As far as the Iconic subscription is concerned, you get the Unacademy platform, and also at the same time you get the Prep Ladder subscription also. All the clinical notes, video lectures, question bank, rapid revision, and treasure notes. This is the Iconic subscription for the newcomers. We have Plus subscription and we have the Iconic subscription. And anyone wants to take any subscription, this is a small code which will be little financially benefit for you if you want to take the whole pack. And also at the same time, if you're a newcomer, we have a Unacademy app. In the Unacademy app, we have a special class. In the special class, we put lot of MCQs polls so that our confidence gets increased. We can ask any doubt anytime. You never miss the classes because all the lectures are recorded, and at the same time, most importantly, you get the notes, you get the PDF notes, all the lectures. Okay, and we have the best of the best, highly effective and updated question bank. And also at the same time, a beautiful congratulations to our NEET PG students, September 2021. And also the FMG results is out, and we have enormous amount of students and results coming from the Unacademy, and which is a very great success. It has been a super hit, and that's why today we're going to talk about what is the next approach. What is the next approach? Okay. ओके ओके संधू सेज पढ़ने का बिल्कुल मन नहीं कर रहा, हाउ शुड आई मोटिवेट माई सेल्फ? अभी बताता हूँ, रुको एक सेकंड रुको तो. And also at the same time in Unacademy, we have this free test rituals. We have the free test rituals. We have the test on Friday, Saturday, Sunday. All those days we have tests, and you can do the test anytime, any day. Because the more you do the test series, the more your confidence will increase. And also at the same time, we have a focus FMG 2022 and target NEET PG 2022 batch, which has been going mind blowing. All the thanks to you, and that is why I want you all to give your best shot in any exam you give, because I mean, being in an academy, we have so many MCQs we have done, and the result has been amazing. So last 3 year question papers are like everything. Okay. So now Sandhu says we have a very dear student. Her name is Sandhu. She says, "Sir, पढ़ने का बिल्कुल मन नहीं करता है. How should I motivate myself to study?" So how should you motivate yourself to study? Sandhu, point number one, make, if possible dear, make small timetable. Like what happens, like if you make a very big timetable, like next 3 days I'm gonna study medicine, next 5 days I will study pediatric, big timetable won't work. For example, right now it is 3:30 p.m, it is 3:30 p.m right now. So if you are anytime studying, so make an alarm that 3:30 to 3:45, 3:30 to 3:45, at least you will finish 10 MCQs, something like that. What I'm trying to say is make small timetable. Give yourself small targets. Don't give yourself a very big target that I will study for 12 hours and 8 hours. Give yourself thoda target. That is the first option. Second option, Sandhu, you have again that how should I motivate myself, how should I study? As in, most importantly, again, Sandhu, do the at least revise. And there has been times in a day when you don't want to study anything new. There has been times in a day when you are frustrated and you don't want to study anything new, because new things becomes very tough to understand, and you are like, oh my god, it is so tough, I don't think so I can do it. So at that time, when you are stuck, when you are really stuck, you at least revise the previous videos, you at least revise the previous MCQs. As for example, like you don't feel like studying today. Okay, today you don't feel like studying at all, but you have to study because you don't have any other option, right? You have to study. but you don't feel like studying at all. So at least number one, in that case of course you can't study any new thing, कुछ नया चीज पढ़ना तो ऑप्शन में ही नहीं है. Second option you have is nothing but to revise the old thing. Revise the old thing. Like for example, like today, okay, today I don't feel like studying at all, so I'll just do one thing. Let me just start from the chapter 1 of pediatrics, and let's just re-watch the video and revise the video of Dr. Anand in 1.5x. Okay, I don't want to watch the video also. If you don't want to watch the video also, at least let me just revise the MCQs of breastfeeding. Let me revise the MCQs of milestones. I'll do one thing. See, I'll do one thing. It's 3:30 right now, so till 4 o'clock I will study. 30 minutes I will finish all the MCQs of breastfeeding. Then 30 minutes I will finish all the MCQs of milestones. Then 30 minutes I will finish all the MCQs of neonatology. So what are you trying to do? In this case, you are not studying anything new, but you are revising the previous stuff. देखो संधू, पढ़ना तो है. That's very true संधू के टाइम टेबल अचीव नहीं हो पाता. टाइम तभी मैं कह रहा हूँ कि बहुत बड़ा टाइम टेबल मत बनाओ यार. छोटा टाइम टेबल बनाओ, कोशिश करो करने की ना. छोटा टाइम टेबल बनाओ, हाफ एन आवर का टाइम टेबल बनाओ, 45 मिनट्स का टाइम टेबल बनाओ. देखो टाइम टेबल बनाना तो पड़ेगा संधू, बिना टाइम टेबल के बात नहीं बनेगी डियर. ऐसा नहीं है कि मतलब वही मैं कह रहा हूँ देखो अभी भी आई टेल यू व्हाट, लाइक टिल टुडे आई स्टडी. इफ यू सी माय नोटबुक, आई स्टिल हैव अ टाइम टेबल. स्टिल आई हैव अ टाइम टेबल इन माय नोटबुक इटसेल्फ कि मुझे 3 से 4 ये क्लास लेना है, 4 से 5 मेरे को रेस्ट करना है, 5 से 6 मेरे को एक और क्लास लेना है, 6 से 7 मेरे को जिम जाना है. सो एवरी सिंगल लाइन, एवरी सिंगल आवर इज कैलकुलेटेड. तो समटाइम्स व्हेन यू फील फ्रस्ट्रेटेड, समटाइम्स यू फील लाइक ओ माय गॉड ये तो हो ही नहीं रहा है, मुझसे तो नहीं होगा, मुझे नहीं लगता होगा. तो पॉइंट नंबर वन, एटलीस्ट एट दैट टाइम either you make small टाइम टेबल्स, बड़ा नाम रखे 15 मिनट, 20 मिनट, एटलीस्ट 30 मिनट्स. 30 मिनट्स तो कंसंट्रेट कर सकते हो ना. लेट्स जस्ट रिवाइज एमसीक्यूज ऑफ ब्रेस्ट फीडिंग फॉर 30 मिनट्स. लेट्स जस्ट रिवाइज द एमसीक्यूज ऑफ माइलस्टोन्स फॉर 30 मिनट्स. तो ऐसे 30 करके एटलीस्ट यू कैन फिनिश द टॉप 5 एंड टॉप 6 एंड टॉप 7 टॉपिक्स विच यू हैव ऑलरेडी रेड. एटलीस्ट यू आर रिवाइजिंग दैम, बिकॉज रिवाइज तो करना जरूरी है, रिवाइज तो वैसे भी करना जरूरी है. तो समझ रहे हो मेरी बात को. दिस इज द ओनली ऑप्शन यू हैव डियर. या तो छोटे टाइम टेबल बनाओ या चीज़ों को रिवाइज करो. तब भी पढ़ने का मन नहीं करा, तब भी मोटिवेट नहीं हो रहा, किसी फ्रेंड से बात कर लो, किसी टॉपर से बात करो, किसी अपने हु हैज़ क्लियर्ड द एग्जाम उससे बात करो, उससे बोलो. वो कहेगा हो जाएगा यार, कोई टेंशन नहीं, हो जाएगा. यू कैन टेक अ स्मॉल ब्रेक, यू कैन वॉच अ मूवी, एटलीस्ट लिसन टू अ गुड सॉन्ग, ट्राई टू जस्ट रिलैक्स योर माइंड. गो टेक अ गुड हॉट वाटर बाथ. मे बी वंस यू टेक अ हॉट वाटर बाथ यू कम बैक, देन यू माइट फील लाइक स्टडिंग. छोटे छोटे टाइम टेबल, 15 मिनट, 20 मिनट, 20 मिनट में एटलीस्ट मैं 15 MCQ, इस MCQ नंबर 1 टू MCQ नंबर 15 इतना करूँगा 15 मिनट में. ऐसे छोटा छोटा अपने आप को छोटे छोटे ट्रीट्स देने की कोशिश करो, छोटे छोटे टारगेट्स देने की कोशिश करो. उम्मीद है हो जाएगा संधू, हो जाएगा. ठीक है, कोशिश करो. So now coming to the FMG, as the FMG results are out, so there was a very recent people were talking that how to make a preparation chart so that you can remember at the end of exams. It's a very important thought. How to make a preparation chart. मतलब this is for the students कि सर मैंने पढ़ाई कर ली पूरी, लेकिन अब should I read everything again? Sir, should I revise all the MCQs again? Sir, should I revise all the theory topics from chapter number 1 to chapter number last again? Like, what is the smart work or what is the trick or how to make a preparation chart so that you can remember at the end of exam? See, exams के end आते हैं तो हमारे पास एक कुछ कुछ mouthful मतलब fruitful content होना चाहिए, right? You can't study everything in the end of the exam. You need to have that fruitful content. तो fruitful content क्या होगा? Number one, you all should have a revision chit. रिवीजन चिट मतलब योर रिवीजन नोट्स. जो भी नोट्स आप बनाते हैं, लाइक संधू यू हैव मेड सच अ माइंड ब्लोइंग नोट्स. आई हैव सीन योर नोट्स ऑफ पीडियाट्रिक्स. मोती की तरह तुमने नोट्स बनाए हैं, इतने कलरफुल, इतने अच्छे, उसमें फोटोज, पिक्चर्स, मतलब और क्या चाहिए. ऐसे करोगी तो पूरा सिलेबस खत्म हो जाएगा, पूरी किताब, पूरे सब्जेक्ट्स खत्म हो जाएंगे. ऑल यू नीड टू हैव एज अ गुड होप, एक गुड पॉजिटिव होप होगा कि यार हो जाएगा, कोई टेंशन नहीं, हो जाएगा. ठीक है. So point number one, very importantly, we need to understand is anyone who is planning to give exam now, like what is the next approach? Point number one, your notes, your revision notes are like everything. Very beautiful, highlighters, colors, sketch pens. Very beautifully, you should write your revision notes. जो भी आप किसी फैकल्टी का क्लास अटेंड करते हैं. सेकेंड मोस्ट इंपॉर्टेंट, येस, नाउ दिस इज अ वेरी गुड कंसेप्ट. दिस इज अ वेरी गुड कंसेप्ट ऑफ पेज नंबर. सर क्या है सर ये कंसेप्ट पेज नंबर का, मुझे समझ में नहीं आ रहा. तो पेज नंबर का कंसेप्ट ये है. नाउ दिस इज समथिंग फॉर अ स्टूडेंट हु इज प्लानिंग टू गिव एग्जाम आफ्टर 3 to 4 months. इफ योर एग्जाम इज 4 months अवे, देयर इज अ कंसेप्ट ऑफ पेज नंबर। सर कैसा क्या होता है सर, कंसेप्ट बताना जरा एक बार। सो बेसिकली क्या होता है, फॉर एग्जांपल इफ यू रीड एनी बुक, इमेजिन एनी थियोरी बुक, मेडिसिन, सर्जरी, गाइनी, ऑफ्था, एनीथिंग, यू स्टार्टेड रीडिंग दैट बुक, एक बार तो किताब पढ़ोगे ना पूरी, विच एवर कोचिंग क्लास और विच एवर कोचिंग बुक you have taken, you will read that book, right? And that book will be having theory followed by MCQs, theory followed by MCQs, right? That's how it is there in every book. So once you start reading the book, for example, you started reading the book of pediatrics, page number 1 you read, page number 2, 3, 4, page number 7, पेज नंबर 7 had a milestone का table. Imagine page number 7 had a milestone का table. So what will you do? For you, that milestone wala table is very, very, very important. Milestones you always forget. It is your weak point, so it is important. So I assume that you know that page number 7 for you is very important. So what will you do? In your book itself, you will go to the index. You will go to the page, first page of the book, a blank paper of the initial pages of the book, and you will write page number 7. You'll just write the page number 7. So that tells that according to you, from this book, page number 7 for you is very important. Okay, आगे बढ़ते हैं. Okay, then you're reading page number 8, page number 9, page number 10, 12, 13. Then come page number 26. Page number 26 has a picture of inborn errors of metabolism. Page number 26 has a picture of inborn errors of metabolism, like Mousty order urine, cabbage order urine, all those urine orders you have. So according to you, page number 26 is so important, you're always forgetting. So what will you do? You will again go back to page number 1, your index page, your blank page of the book. You will write page number 26. So like that, once you finish the whole book, once you finish the whole book, then page number 7, page number 26, page number 38, 77, 106, like by the end you finish the whole book, you will left with the most important, most high yield, most tough for you, most tongue twisting for you, and most forgettable topics for you. You will be end up having those one in the whole lined up. So before your exam, just before, after 1 week before your exam or 1 month before your exam, you should always, these are the topics, these are the page numbers, you must revise them. Because according to you, होता है ना, हर किसी के लिए कोई ना कोई चीज़ बहुत इंपॉर्टेंट होती है कि यार मेरे हिसाब से माइलस्टोन में पक्का क्वेश्चन आएगा। कुछ होता है ना, क्वेश्चन पेपर हम खुद बनाते हैं कि ये तो पक्का ही आने वाला करके। सो वंस यू एंड अप रीडिंग द बुक, यू विल हैव दिस पेजेस लेफ्ट विद यू, कि दीज आर द प्राइम पेजेस, एंड बिफोर द एग्जाम यू शुड ऑलवेज रीड दोज टॉपिक्स, दोज पेजेस, एंड दोज आर वेरी हाई यील्डिंग एंड मोस्ट इंपॉर्टेंट टॉपिक्स अकॉर्डिंग टू यू। समझ में आ रहा नहीं आ रहा? आर यू अंडरस्टैंडिंग? सो दिस इज द कंसेप्ट ऑफ पेज नंबर. So this is one topper only had told me, and it has really helped him. That's why. So I'll repeat again. Number one, your revision notes. Like, see, FMG exam is over now. Now coming to the next exam. How should be my approach? Number one, whatever faculties classes you're attending, any faculty, any subject, your notes are like pearls. मोती की तरह आपके notes होने चाहिए सुंदर तरीके से. Then you have a concept of page number. I told you, जो भी पढ़ो अच्छे से पढ़ो, लेकिन पेज नंबर लिख देना कि ये पेज नंबर मुझे टफ लगते हैं, और एंड में आई विल रिवाइज देम. Next, very important, you need to understand high yield content. High yield content. Everyone keep asking me, सर important topics का list बता दो सर शुरू के चैप्टर करें तो आ जाएगा, पास हो जाएंगे सर. So my dear, high yield content, last 3 year question papers, last 3 year question papers of everything. Just now recent FMG paper also was of very good level. Okay, so last 3 year question paper of NIMANS, JIPMER, AIMS, PGI, Chandigarh, and everything, you finish the last 3 year question paper, they are the high yield content. Okay, again, FMG results are out now. Next, how, what should be my approach? So my approach should be, number one, my notes should be very, very good. My approach should be this concept of page number. My approach should be कि लास्ट 3 साल के पेपर तो मेरे को आने ही चाहिए, कुछ भी हो जाए करके. एंड ऑल्सो एट द सेम टाइम वी ऑल नो दैट समराइजेस बिग टेबल इन वन, समराइजेस बिग टेबल इन वन. अब ऐसे तो नहीं, ये टेबल देखोगे तो चक्कर खाए गिर जाओगे. समथिंग लाइक दिस, समथिंग लाइक अ वॉल पोस्ट, जो हमने भी किया था, आपने भी किया था, एवरीवन डज फॉर देयर एग्जाम्स. समराइजेस बिग टेबल इन वन, like this wall post, like this important topic. Everyone has done this in their school times and in their college times, and I also had did that. Okay, and again, very important, be imaginative. See, I have a different way of studying, and Shubhangi has a different way of studying. I cannot study like Shubhangi, and Shubhangi cannot study like me. Some people have a hobby of study in the night, and some people have the habit of studying in the morning. So it's everyone's perspective. So you have to be very imaginative. मेरे को अगर रात को पढ़ना पसंद है तो मेरे को रात को पढ़ना ही पसंद है. That's how I will study, and that's it. Okay, you can't copy anyone. There is was a saying, right? I have told this thing before also, that there is no shortcut to success. There is no shortcut or no elevator to success. We all have taken the stairs. Every single person who has passed the FMG exam, every single, they have been, there is a student who got 256 marks also. So every single person who have passed the exam, there is no shortcut. There is no shortcut. आपका 2 दिन का क्लास करेंगे तो पास हो जाएंगे सर, खाली शुरू के 3 चैप्टर करेंगे तो पास हो जाएंगे. अरे भाई बिल्कुल पास नहीं होगे. You have to do my theory videos, then you have to do a lot of MCQs, then you have to attend my live classes and do again a lot of MCQs, and then you will pass. So there is no shortcut to success. There is no shortcut to success. We all have taken the stairs. So that's very important. Okay. And again, at the same time, let's study some important things. As this is the FMG results are out, so we have the next batch coming. So I have made some very rare conditions and very difficult image based and video based questions I have made, which is a collaboration of the last 3-year question paper. So let's just finish few questions about it and let's enrich our knowledge. And always before starting a quote, we always have a motivating quote. So pain is temporary. Pain is temporary. Sandhu says नहीं हो रहा नहीं हो रहा नहीं हो रहा करके. Pain is temporary. Quitting lasts forever. बिल्कुल ही क्विट मतलब और करें क्या संधू, करना तो पड़ेगा. एवरीथिंग इज टफ. frankly I tell you, everything is tough. Being a compounder is tough. Being a housewife is tough. Being a nurse is tough. Being a doctor is tough. Being a engineer is tough. Being a servant is so tough. Being a housewife is so tough. Being a housekeeper, being a security guard, every job is tough. No job is easy. Every job is tough. Being a doctor is very tough. Now the question is, which stuff you are okay taking it? Which stuff you feel that I can take it? Some people says नहीं नहीं डॉक्टर मत बन, इंजीनियरिंग कर ले, अरे हल्का वाला फील्ड चूज कर. Engineering also is tough. Working in a multinational company is also tough. Everything is tough. Which stuff you are okay doing it? Which stuff you love to do it? And that is what is your key to success, and that is your goal. Teaching is very tough. I teach 8 hours per day, 10, 12 hours per day, every day. You know how suffocating my voice becomes? I get so tired teaching so much, and so much of pressure I have to put on my tonsils and on my voice. Teaching is also very tough, but I love teaching. But I love teaching, so I'm doing it beautifully. So that's how you should do it, right? So everything is tough, लेकिन डॉक्टर बनना है, अगर सोचा है, सपना है, तो करना ही है और अच्छे से करेंगे. कोई प्रॉब्लम नहीं है उसके अंदर. ओके, दैट्स व्हाट. स्टे पॉजिटिव, बिकॉज स्टेइंग नेगेटिव विल नेवर हेल्प. स्टेइंग नेगेटिव हैज नॉट हेल्प्ड एनीवन. So stay positive. If the FMG results are out, there has been students who are messaging me from morning. Someone has got 149, someone has got 148 also, and there is a student who got 256 also, 267 also. They also messaged me. So this is life. आज किसी और का दिन है तो कल तुम्हारा दिन होगा. तो कोई ऐसी बात नहीं है, मेहनत करना है बस, और कुछ नहीं करना. Let's start the important questions. The important questions of the last 3 year for FMG. We have a collaboration here. Let's see how do we start the whole topic. Question number 1. So Sandhu, what do you think? Anyone? What is this sign? ये क्या है? What is this sign? This sign. There's some BP cuff and my fingers are like that. Once you inflate the sphygmomanometer, once you inflate the BP cuff, this hand becomes like a posturing. The hand becomes like a posturing. So what do you call this condition? Is one of the very simple and very nice question. Let me show you a video of this also. Very nice video, this one. What is this? It's a very, very, very good video. Can we appreciate this? Yes, very good. So Sandhu, what do you think? What is this video showing? Can we see that? It's such a beautiful video. Can we see that once our doctor, she inflated the sphygmomanometer, once the doctor inflated the BP cuff, can we see that? Yes or no? The hands, see the hands, see the hands. The hands are they're going into tonic posturing. Tonic posturing. संधु कहाँ मिलता है ऐसे, क्या बोलते हैं इस साइन को, किसमें मिलता है ये साइन? So this sign is nothing but have you heard of tetany? Have you heard of latent tetany? This sign where you have this posturing, tonic posturing of the fingers, nothing but Trouse's sign. Very important. It's nothing but TROUSSEAU, Trouse's sign. Yeah, have you understood this name? Hanji, very good. So right, we have Chopstick sign and Trouse's sign seen in latent tetany in hypocalcemia. As child calcium was 5.5, this baby's calcium was 5.5. Normal calcium is 8 to 10. So the child will show the sign without inflating BP cuff. Like in this patient, this one. I don't even have a beeping cough, and still the baby is showing tetany. So once the cases of severe hypocalcemia, baby can show you a Trousier sign without inflating a BP cuff also. But in general, this is the perfect video, a very beautiful image-based, video-based learning, which you can appreciate in this video is nothing but Trousier sign. Very good, Paras. Very good. So Trousier sign. Okay, so what is Trousier sign? The hand adopts a characteristic posture like a spasm. Hands adopt a spasm when the BP cuff is inflated above the systolic pressure within 5 minutes. Okay, when the BP cuff is inflated above the systolic pressure, the hand becomes spasm, like a spasm characteristic posture. That is Trousier sign. Next thing, what is this, anyone? I'll give you a topic. Sandhu, Paras, what is this? Any random guesses? What do you call this? क्या कर रहे हैं? Once you stimulate the angle of the mandible, what sign? What do you call this? Most importantly, have you heard of chopstick sign? Yes or no? Nothing but yes. Very good. Have you heard of chopstick sign? Twitching of the facial muscles. Twitching of the facial muscles in response to tapping over the facial nerve. Once I tap over the facial nerve, there is twitching of the facial muscle, little twitching. Can you see that? So yes, Paras is very right. It's nothing but chopstick sign, twitching of the facial muscles in response to tapping over the area of facial nerve. Again, let's see this video, this one. Yeah, can we see that twitching of the facial muscle? Very beautiful picture, a twitching of the facial muscles. Okay, very good. Next question. Okay, so what is this sign? This is also very beautiful test. Anyone? So we have Paras, we have Sandhu. What test is this? I am holding my fist and I'm blocking my radial and ulnar artery. Once I block my radial and ulnar artery, I will open one artery. See, so I have blocked my radial aspect and ulnar aspect. So see now. Once I open my radial artery, my hand color changed. Once I open one aspect of my artery, radial artery, my hand color changed. So what do you call this test? Very important. See, I am putting a fist, you are blocking my radial artery and ulnar artery, and what will you do? Any one side you will open my what you called artery. This time this side you open my ulnar artery, and again you saw the blood coming to in my this one. Yes or no? So what do you call this, anyone? Paras, Sandhu, क्या बोलते हैं इसको? This is known as Allen's test. Very important. This is known as Allen's test to make sure the collateral circulation is present. Very important test. Means that my radial artery is patent and ulnar artery is patent. To confirm that, I will do Allen test. I will put a fist. You will block my radial and ulnar artery. Then in one time you will open one artery. This time I'm opening radial artery and seeing the flow of the blood, whether it is going or not. And then again I will do for the other side also, radial artery side also, ulnar artery side also. Why are you doing this, sir? Just to see whether the both arteries are patent or not. Why do you do this, anyone? Sandhu, Paras, why do you do Allen test? करते क्यों Allen test? मेरा तो मन नहीं है करने का. You do Allen test in a patient of acute kidney injury, AKI, or in the patient of, you can say, renal transplantation, or patient who's on hemodialysis. Patients who are on hemodialysis. Okay, patient who are on hemodialysis, in those patients you will make a arteriovenous fistula. You make a arteriovenous fistula. Yes or no? Have you heard about it, Paras? Yes. So you make a arteriovenous fistula in a patient for a kidney injury or for the hemodialysis. So once you make a arteriovenous fistula, you have to do a Allen's test. You have to do a Allen's test before doing any arteriovenous fistula. वरना वो पूरा खत्म हो जाएगा एक साइड वाला हाथ. ठीक है? So everything will make sense. Everything will make sense. The struggle, the pain, the hard work, everything will make sense. Today it looks very difficult. Today the struggle looks too much. The pain looks unbearable and the hard work is so much. But everything will make sense. हर चीज, everything will make sense. Just थोड़ा सा और सब्र करो, सब ठीक हो. ठीक है? Okay, next important. So can anyone mention what are the findings seen in this baby? What is the syndrome? Like what are the findings? Okay, if I just want to know the findings in this baby. Any random guesses? Which syndrome is this? So point number one, very important. In the eyes, what can you see? Something known as anti-mongoloid slant. This baby is having anti-mongoloid slant. Point number one, anti-mongoloid slant. Yeah, exactly. Sandhu is right. Your eyes can't see what your brain doesn't know. So your eyes can't see what your brain doesn't know. अच्छा वो लग रहा है इसके अंदर. अच्छा ठीक है. So Sandhu, number one, we can see a anti-mongoloid slant. What is anti-mongoloid slant? Downward slanting of eyeballs. Downward slanting of eyeballs. Yes, this is nothing but anti-mongoloid slant. And point number two, very important. Can we see this? These babies are having a tracheostomy tube. Yes or no? See this one. They are having a tracheostomy tube. They are having a like a open tracheostomy has been done for them. So very importantly, Hanji. वेरी ट्रू सात्विक राज सर वे कैन आई गिव यू पार्टी पार्टी किस लिए क्या हुआ रिजल्ट आ गया पास हो गए अच्छा अच्छी बात है पार्टी कब दोगे बताओ सो दिस केस इज नथिंग बट ट्रीचर कोलिन सिंड्रोम दिस इज अ केस ऑफ ट्रीचर कोलिन सिंड्रोम सर ट्रीचर कोलिन सिंड्रोम हाँ जी what are the points of treacher collin syndrome now remember one thing treacher collin syndrome is one syndrome there you have to know some findings these are the picture this is the picture of treacher collin syndrome so what is the highlighter सर कैसे मैं इसको पहचान पाऊंगा ये बताइए सर सी गांधी जी के तीन मंदिर इन ट्रीचर कोलिन सिंड्रोम यू शुड नो गांधी जी के तीन मंदिर गांधी जी थ्री मंकीज मीन्स लाइक what did गांधी जी said गांधी जी said बुरा मत देखो गांधी जी said don't see the bad stuff but these babies they saw the bad stuff so they got coloboma of the lower eyelid coloboma of the eyelid is the first finding for the ट्रीचर कोलिन सिंड्रोम गांधी जी के तीन बंदर गांधी जी ने कहा कि बुरा मत देखो इन्होंने बुरा देखा दे गॉट कोलोबोमा व्हाट इज कोलोबोमा एनीवन आई शो यू अ पिक्चर ऑफ कोलोबोमा दिस वन कोलोबोमा is nothing but congenital abnormality of the membranes of the eye this one can we see that yes or no please put a like button if you're able to see that okay सात्विक पार्टी कहाँ दे रहे हो ये बताओ पार्टी बेटा पार्टी ज़रूरी है तो पार्टी शुरू कहाँ दे रहे हो दिल्ली आ जाओ तमपुरा में रहता हूँ मैं okay yes. Yes, can we see that? So most importantly, number one, the Gandhiji said, "Don't see the bad stuff." They saw the bad stuff. They got coloboma of the eyelid. This is coloboma. Can we see that? Yes or no? This is this one. This is the coloboma. This is the like a what is coloboma? Congenital abnormality of the membranes. Congenital abnormality of the membranes of the eye. This also. Can we see that? This picture. This one. काइंड ऑफ अ होल इन वन स्ट्रक्चर ऑफ द आई ठीक है कोलोबोमा सो गांधी जी ने बोला बुरा मत देखो गांधी जी ने कहा बुरा मत सुनो बट दीज बेबीज दे हर्ड द बैड स्टफ एंड दे गॉट डेफनेस गांधी जी ने कहा बुरा मत बोलो बट दिस बेबी दे स्पोक द बैड स्टफ सो दे गॉट द माइक्रोगनेथिया और अंडर डेवलप्ड चीक्स माइक्रोगनेथिया और अंडर डेवलप्ड so these are the findings of the Treacher-Collins syndrome. Very importantly, coloboma of the lower eyelid, deafness, micrognathia, and underdeveloped cheeks. Underdeveloped cheeks. Very good, Hemal. Very good, Satvik. Sandhu. Very good. And remember one thing: this Treacher-Collins syndrome. They are the dominating student. They are very dominating because they don't hear. They don't listen to you. गांधी जी ने बोला बुरा मत देखो बुरा मत सुनो बुरा मत बोलो बट दे डिड एवरीथिंग दे आर वेरी डोमिनेंट सो दे आर डोमिनेंट मीन्स इट इज अ ऑटोसोमल डोमिनेंट इनहेरिटेंस Treacher Collins syndrome are very autosomal dominant inheritance. Treacher Collins syndrome are nothing but autosomal dominant inheritance. Satvik says, thanks, sir. Whenever you want, we'll come to Delhi after a few days, sir. हाँ जी जल्दी आओ मैं इंतजार कर रहा हूँ जल्दी आओ ठीक है डन दैट फिनिशेस ट्रीचर कोलिन सिंड्रोम समझ में आ रहा है कि नहीं आ रहा सो ट्रीचर कोलिन सिंड्रोम पॉइंट नंबर वन दे आर द डोमिनेंट स्टूडेंट्स ट्रीचर कोलिन एंटी मोंगोलॉइड एंटी सो नाउ कैन वी अप्रिशिएट दे हैव दिस हाइपोप्लेजिया ऑफ द चीक्स गांधी जी ने कहा बुरा मत बोलो दे स्पोक सो दे हैव दिस माइक्रोगनेथिया और यू कैन से वेरी इंपॉर्टेंटली अंडर डेवलप्ड चीक्स गांधी जी ने कहा बुरा मत सुनो सो कैन वी सी दैट दे डोंट हैव ईयर्स एट ऑल दे हैव काइंड ऑफ अ डेफनेस लाइक दैट and T for Treacher Collins syndrome, T for TCOF1 gene mutation. Treacher Collins syndrome, TCOF1 gene mutation. That finishes one syndrome, Treacher Collins syndrome. Done, done, done. This is a very beautiful case. This is a very beautiful case of Treacher Collins syndrome. Thanks to Dr. Anurag, one of my favorite junior from Jammu. Dr. Anurag, he told me that number one, the patient has low set ears. He has low set ears. Point number one. Again, Gandhi said, "Bura mat suno," and they heard the bad stuff. So their ears are not well developed, and they even Gandhi ne kaha, "Bura mat bolo," and they got underdeveloped cheeks. Underdeveloped cheeks. Okay, very good. Next question. What is this sign? Anyone? What is this sign? सात्विक congratulations bro बहुत अच्छा रिजल्ट है बहुत ही प्यारा रिजल्ट है पर इस रिजल्ट का तभी भरपाई होगी जब यहाँ आएंगे और कहीं चलेंगे कहाँ चलना है कैन गो टू Akshardham you want to go Akshardham you want to go to Lotus Temple or we'll go to a nice chicken place we can have a good chicken हाँ जी वेरी गुड संधू हाँ जी क्या है ये हम कर चुके हैं संधू ये क्या है बताओ जल्दी से तो दिस इज नथिंग बट एरेक्नोडेक्टाइली हैव यू हर्ड ऑफ एरेक्नोडेक्टाइली यस और नो व्हाट इज एरेक्नोडेक्टाइली Erythrodactyly is long, slender fingers. Yes or no? Long, slender fingers. Arachnodactyly. Very good. Where do you see arachnodactyly, anyone? Yes, you see in Marfan syndrome. Arachnodactyly you see in Marfan syndrome. And yeah, this thumb sign and wrist sign is seen in is seen in Marfan syndrome. Yes, that's very true, Hemal. Perfect. Okay. Long, slender fingers, arachnodactyly, and is seen in Marfan syndrome. That's very true. And we already know the this one of Marfan. Marfan details we will not do right now. I'll ask you the next question. So the next question is yes. What is this? Yes, my dear Satvik. Yes. What is this? Anyone? What is this chest uh, depression and chest this protrusion? Anyone? What do you call this condition? Hemal, Sandhu, Satvik. What do you call this? क्या कुछ कुछ लग रहा है chest में कुछ abnormality लग रही है आपको या नहीं लग रही है करके? Any random guesses? Yes, exactly. So this one, this is nothing but pectus carinatum, pectus carinatum, like a protruding chest, and one we have the pectus excavatum, pectus excavatum, or nothing but depressed chest. So protruding chest will be pectus. Have you heard the names? Yes or no? In respiratory system examination on inspection, you see any abnormality in the shape of the chest, we have pectus carinatum and pectus excavatum. Pectus carinatum is nothing but protruding chest bone. That is pectus carinatum, and depressed or sunken chest bone is pectus excavatum. That you should know. Okay, okay, yeah. I'll give you 30 seconds to answer this question. Identify the syndrome. These three pictures are there. These three pictures are there. Identify the syndrome. What do you think, anyone? What is the name of the syndrome? Yes. Okay, if I give you highlighters, Sandhu, if I say high arch palate, high arch palate, हाई आर्च, ये जो आर्च है ये वाला अंदर वाला इट्स हाई आर्च, बहुत ऊपर है. Intellectual disability, this one is mental retardation or intellectual disability, and they have very large ears, they have very large ears. So what is this syndrome? And everything is very large, large testes. Okay, Russell Silver, no. Anything else? High arch palate with large ears and large, testes, and everything is very large, and mental retardation. This is nothing but Fragile X syndrome. Fragile X syndrome. In Fragile X syndrome, number one, it's seen in male. And Fragile X syndrome, very importantly, everything is long or large in Fragile X syndrome. Long face, prominent forehead. Okay, let's see this picture. Prominent forehead, long face, and very important, even the jaw also a little long. Large testes, large ears, high arch palate, but not large nose. That's another exam question. Yes, Hemal is right. Yes, the please remember star mark. It has been an exam question that do you see a large nose in Fragile X syndrome? The answer is no. You don't see large nose in the case of Fragile X syndrome. And Fragile X syndrome, very important. It's one of the, okay, who will tell me? So I'll repeat again, okay. It's a male baby with mental retardation, which is now known as intellectual disability. In Fragile X syndrome, everything is large. Large face, large forehead, large jaw, large testes, large ears, high arch palate, but not a large nose, but not a large nose. That finishes Fragile X syndrome. Next, which is the most commonest cause? Which is the most commonest cause of mental retardation in children? Anyone? Which is the most commonest cause of mental retardation in children? Yeah. Satvik says, Sir, I'm not feeling like studying now, but I am just listening casually now as your class is stress free. Story. Yes, Satvik. Yes, dear. I can understand. And you are there, right? I hope you are there. You are there with me on WhatsApp, right? I hope you are friends on WhatsApp, Satvik. And the first most common cause, the first anyone, which is the most commonest cause of mental retardation. So the most commonest cause, I would say, the most common non-preventable cause of mental retardation is nothing but Down syndrome. The most common नॉन प्रिवेंटेबल कॉज जिसमें बच्चे को बचाया नहीं जा सकता, लाइक नॉन प्रिवेंटेबल. इफ देर इज अ मेंटल रिटार्डेशन, देर विल बी अ मेंटल रिटार्डेशन. द मोस्ट कॉमनेस्ट कॉज इज डाउन syndrome, and second most commonest is fragile X syndrome. The most commonest cause of second most commonest cause of mental retardation is fragile X syndrome. This is non-preventable. And what is preventable? प्रिवेंटेबल ऐसा क्या है जो बचाया जा सकता है बच्चा, मतलब सारी उम्र बच्चा मेंटली रिटार्डेड ना हो, which is now known as intellectual disability. So how can I prevent that? Do we have any condition which is preventable cause of mental retardation or intellectual disability? The answer is hypothyroidism. congenital hypothyroidism. Congenital hypothyroidism. In that baby, basically, that's a preventable cause. You can prevent. That's a very beautiful thing. See, being a doctor, you can prevent someone being forever mentally retarded. So, in hypothyroidism, congenital hypothyroidism is one of the preventable cause of mental retardation. ठीक है, सात्विक है ना number बस. Very good. Okay, this is one of my friend. His name is Dr. Sunil. He went to a market and he got this thing. He got this tomato. Okay. So by looking at the tomato, like by looking at the tomato, what do you think? What is this? Like which in which congenital heart do you see this? Very good. Satvik, Sandhu, Hemal, अपना शुभांगी, Paras. In which heart disease you see such tomato? So number one, can we see it's like a figure of eight appearance? Yes or no? Figure of eight. It's like a figure of eight appearance. So the answer is supracardiac TAPVC. Supracardiac TAPVC. Supracardiac TAPVC. You see figure of eight appearance. Whether he tetralogy of Fallot will have a boot-shaped heart. If I show you a boot, then you can say boot-shaped heart is seen in tetralogy of Fallot. Otherwise, this is nothing but figure of eight appearance. Figure of eight appearance or nothing but supracardiac TAPVC. Remember in the yesterday's class we have done, yes, exactly, Paras is right, total anomalous pulmonary venous connection. But remember supracardiac TAPVC will present as as figure of 8 appearance. Okay. Next, where do you see string sign? These are the last 3 year question papers for FMG. Let's see if you can answer. Where do you see string sign? String sign, or I would say this one, string sign, or nothing but double track sign. Anyone? Yes. So string sign you see in hypertrophic pyloric stenosis, congenital hypertrophic pyloric stenosis. And anyone? The mother has taken which drug during pregnancy that baby can land up into CHPS? Mother has taken which drug during pregnancy that baby can land up into congenital hypertrophic pyloric stenosis? So the answer is yes, exactly. So the answer is erythromycin. Erythromycin. If the mother has taken erythromycin during pregnancy, baby can land up into congenital hypertrophic pyloric stenosis. Okay, very good. And double tract sign, same. Double tract sign also same. It's like a this double tract sign. You see in again congenital hypertrophic pyloric stenosis. Very good, perfect. Okay, that's another beautiful quote. So again, today's quote is, make yourself the best. Make yourself the best and destiny will do the rest. Very beautiful quote. मेक योर सेल्फ द बेस्ट. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. जिंदगी भगवान की एक बहुत ही महंगी गिफ्ट है. तो यू वेस्ट मत करो. तो मेक योर सेल्फ द बेस्ट इन स्टडीज, द बेस्ट इन लुक्स, द बेस्ट टू स्मेल, द बेस्ट टू गो आउट, बेस्ट टू लव, anything. I want you to be the best of the best of the best, because make yourself the best and destiny will do the rest. Yes or no? So this is a very beautiful quote. ठीक है, इसको याद रखना हमें. Okay, let's revise five strawberries. Five strawberries. We have strawberry gallbladder, strawberry tongue, strawberry vagina, and strawberry gingiva. Anyone? Let's finish the easy ones. Where do you see strawberry vagina? Anyone? Vaidehi, Paras, Sandhu, Amit. What do you think? Where do you see strawberry? Exactly. Strawberry vagina. Yes. Strawberry vagina. It is seen in trichomoniasis. That's true. Our Sandhu is right. सिंगिंग कहाँ सिंगिंग आती है मुझे? एक लाइन सुनाऊं? अब तो चाहत सी है मुझको ऐसे जीने में. बाद में करेंगे सेशन, सिंगिंग वाला तो बाद में करेंगे. अच्छा, स्ट्रॉबेरी टंग यू सी इन कावासाकी, or even you see in scarlet fever. Strawberry tongue you see in Kawasaki or in scarlet fever. Where do you see strawberry vagina? Trichomoniasis. Where do you see strawberry gingiva? Anyone? Strawberry gingiva? Strawberry gingiva? Like I want to participate in singing competition also. तो उसमें सात्विक हम साथ में करते हैं participate. Be fun. What do you think? वो गाना भी बहुत अच्छा है वो वाला. सब गाते हैं सब ही मदहोश हैं, तुम क्यों खामोश हैं. राज़े दिल छेड़ो ना, चुप हो क्यों, गाओ ना, आओ ना, ना। वैगनर्स ग्रैनुलोमेटोसिस, ठीक है। अगर बातें हो गई हों, थोड़ा पढ़ाई की बातें कर लेते हैं। तो स्ट्रॉबेरी जिंजाइवा यू सीन वैगनर्स ग्रैनुलोमेटोसिस। स्ट्रॉबेरी जिंजाइवा in Wagner's granulomatosis, strawberry vagina, trichomoniasis, strawberry tongue, Kawasaki and scarlet fever, that you should know. Okay, strawberry gallbladder. Where do you see strawberry gallbladder? My gallbladder is not strawberry, it is normal. हाँ जी। ठीक है। गिटार के साथ गिटार पड़ा हुआ है, एक तो गिटार करता हूँ। एक बंदा कितना काम करे, मुझे बताओ, एक बंदा कितना काम करेगा? 24 घंटे होते हैं। आई समटाइम आई टेल माई फैमिली ऑल्सो, तो एक दिन में 24 घंटे होते हैं, तो 26 होते तो मैं थोड़ा और भी काम करता। So that you should know. Anji, very good. Dr. Stephen Strange is very right. So strawberry, yes, the strawberry gallbladder you see in cholesterosis, number one. Strawberry skull you see in antenatal ultrasound in Edwards syndrome. Strawberry tongue Kawasaki, strawberry vagina trichomoniasis, strawberry gingiva, Wagner's granulomatosis. So strawberry, Hanji, okay. So strawberry's gallbladder is cholesterosis, and strawberry skull antenatal ultrasound in Edwards syndrome, and strawberry scrotum you see in multiple sebaceous cyst. Strawberry scrotum you see in multiple sebaceous cyst. Remember, strawberry vagina was last to last year NEET PG question. Strawberry vagina was last to last year NEET PG question. Yeah. थैंक यू सात्विक, थैंक यू। बस मुझे अभी तुम वो करना, व्हाट्सएप कर दो एक बार। नाउ वेस्ट नेक्स्ट वेरी इंपॉर्टेंट, साइड इफेक्ट्स ऑफ ड्रग्स। साइड इफेक्ट्स ऑफ ड्रग्स, वी हैव डन दिस। कैन एनीवन टेल मी ब्रॉन्ज बेबी इज बिकॉज ऑफ ड्रग ऑफ विच साइड इफेक्ट? एनीवन? ब्रॉन्ज बेबी इज बिकॉज ऑफ साइड इफेक्ट ऑफ विच थिंग? तो यस, वेरी ट्रू, वेरी वेदर ही इज वेरी राइट। Bronze baby is a side effect of phototherapy, number one. Gray baby is because of side effects of a drug known as chloramphenicol. Red man syndrome is because of side effects of vancomycin. We have done that. And blue baby is a side effect of amiodarone. Amiodarone. Okay, yes or no? Hanji. Very good, Sandhu. Very good. Okay. That's remember that. Okay, next one. So gray baby chloramphenicol, bronze baby phototherapy, blue baby amiodarone, and red man vancomycin. Done. Okay, blue diaper. Now this is an extra question. Let's see if you can do. One was blue baby. Blue baby is because of our amiodarone drug overdose, and blue diaper is seen in indicanuria. Indicanuria, nothing but known as Drummond's syndrome, where you see bluish urine stained diapers. You will see little bluish, if you can see this picture, bluish urine stained diapers. Very importantly, so there's nothing but blue diaper syndrome. Blue diaper syndrome, yes, that you should know. Done. Indicanuria. Next, this is a good question again. It's like a very smart, this is a smart approach. Where do you see Thompson scoring? Anyone? Have you heard? पढ़ाया हुआ है मैंने. Dr. Stephens, Paras, Satvik, Sandhu, Vaidehi. Where do you see Thompson score? Thompson score किस में करते हैं? Anyone? Thompson score. Where do you see Thompson score? Any random guesses? Yes, Thompson score is exactly. It is done in HIE. Thompson score is done in HIE. Okay, you know that, right? HIE, hypoxic ischemic encephalopathy. In HIE, we do something known as Sarnet and Sarnet staging. Sarnet and Sarnet staging, and we also have Thompson score, or we also have Leveny score. Okay, in HIE, and then we have Thompson liver. Where do you see Thompson's liver? Anyone? Anyone? I'll give you 10 seconds. Where do you see Thompson's liver? Exactly. Where do you see Thompson's liver? Anyone? Any random guesses? Yes, very good. So Thompson's liver is seen in scarlet fever. Very important. Please remember Thompson's liver. Thompson's liver we see in scarlet fever, whereas very important Thompson score we do in HIE, hypoxic ischemic encephalopathy. We do remember that. Okay. Now coming to the next question. Christmas. So most importantly, Christmas. Anyone? Where do you see Christmas? We have a lot of Christmas. Okay, this is a very important question. Christmas just now left. Christmas disease, Christmas tree cataract, Christmas tree rash, Christmas tree adapter, Christmas tree bladder, Christmas tree sign, and Christmas tree appearance of polyp. Very, very, very important. Let's see if you can answer at least one. Very good. So anyone, see, these are the six MCQs back to back of the PG exam. Okay, Christmas disease. I think we all know that hemophilia. Yes or no? Have you heard of Christmas disease? Okay, Christmas disease. You see in hemophilia. Point number one. Christmas disease. You see in hemophilia. Christmas tree rash. Christmas tree rash. You see in pityriasis rosea. Christmas tree rash. You see in pityriasis rosea. Christmas disease. You see in hemophilia B. Christmas tree adapter. Christmas tree adapter is like a adapter for the oxygen tanks. Christmas tree adapter is for the adapter over the oxygen tanks. Then we have Christmas tree bladder. Christmas tree bladder you see in neurogenic bladder. Cystographic appearance of neurogenic bladder, that you should know. Okay, very good, very good. So I'll repeat again. Christmas disease is hemophilia. Christmas tree rash is pityriasis rosea. Christmas tree adapter is used for oxygen tank. Christmas tree bladder is for neurogenic bladder. And very important, Christmas tree sign. Can you see this beautiful Christmas tree, Christmas tree sign? You see in paraspinal CSF leak. You see in paraspinal CSF leak in the radionuclide cysternography. Paraspinal CSF leak. And last but not the least, Christmas tree cataract. Christmas tree cataract. It's like a very beautiful Christmas tree. So you see in myotonic dystrophy. Myotonic dystrophy. You see the Christmas tree cataract. Okay, these Christmas is important. And last but not the least, Christmas tree appearance of polyp. Christmas tree appearance of polyp you see in Pews-Jeghers syndrome. In Pews-Jeghers syndrome, you see Christmas tree appearance of polyp. These 6 7 Christmas are very, very, very important. See, there's something known as hard work and there is something known as smart work. So this is a very, very, very smart work. So Christmas tree polyp is must, you must know. Okay, so I'll repeat again. We have Christmas disease. Okay, Christmas disease is hemophilia. Christmas tree rash is pityriasis rosea. Christmas tree adapter is the one for the oxygen tanks. Christmas tree bladder is nothing but in neurogenic bladder. You see this is such a beautiful. Can we see that this is a Christmas tree or kind of a bladder? Then we have Christmas tree sign in a paraspinal CSF leak in radionuclide cysternography, and Christmas tree cataract you see in myotonic dystrophy. Myotonic dystrophy. These are the very important. And Christmas tree polyp, I told you, Pews-Jeghers syndrome. Okay. Next question. What is this, anyone? What is this? 5 more minutes we will study, then the class is over. What is this? Any random guesses? Can we see the head are attached? So have you heard of craniopegas? We have something known as craniopegas. We have something known as thoracopegas, or we have pyopegas. A lot of pegas are there. So whenever the cranium are connected together, that is craniopegas. When the two thorax are connected together, that is thoracopegas. So this is nothing but craniopegas. Okay, pyopegas means the potty area, the buttocks area when it is connected, that is pyopegas. Okay, remember there are a lot of pegas. Okay, for example, thoracopegas. Can we see this picture? In the thoracopegas, that the thorax are getting attached, yes or no? Ischiopegas, the two ischiums are getting attached. That, like that, you should know. This picture was craniopegas. This picture was there, right? Very good, Paras, very good. So this was craniopegas. This one, two heads were attached. This picture is craniopegas. When the heads are attached is craniopegas. When the thorax is attached is thoracopegas. When the potty area is attached, like this one, like P for potty, P for pyopegas, like that. Okay, that you should know. Again, the next motivating line is be a warrior, not a warrior. Be a warrior. हम लड़ के रहेंगे. We will get the highest score. We will get what we want in life. We will get everything possible. So be a warrior, not be a warrior. टेंशन नहीं लेना. आओगे तो वेलकम, जाओगे तो भीड़ कम. बस बी अ वॉरियर नॉट अ वॉरियर. घबराना नहीं है, टेंशन नहीं लेना. एग्जाम ही है, हो जाएगा. दिस इज नॉट द एंड ऑफ द जर्नी. दिस इज नॉट लाइफ. इट इज अ फेज ऑफ लाइफ. आई ऑलवेज टेल एवरीवन, not life, it is a phase of life. So be a warrior, not a warrior. Okay. Okay, next very important, juvenile myoclonic epilepsy. There was a recent question for FMG for juvenile myoclonic epilepsy. So can anyone tell me how does the patient presents to you with a case of juvenile myoclonic epilepsy? Anyone? How does the patient present? कैसे आपके पास patient जो है present करता है a case of juvenile myoclonic epilepsy? Anyone? So twitching of fingers and dropping of objects. Very important. The patient present with twitching of fingers twitching of fingers and dropping of objects. Twitching of fingers and dropping of objects. Okay, twitching. बच्चा बार बार a 7-year-old baby have this habit of twitching of the fingers, and suddenly he is dropping of objects. That happens in juvenile myoclonic epilepsy, like a isolated jerks or twitching of fingers and dropping of objects. And very important, GABRA1. That's another exam question. GABRA1 gene mutation. Anyone? Where do you see ATP7B gene mutation? Any random guesses? Yes. Where do you see ATP7B gene mutation? Yes, ATP7B is seen in Wilson disease, and ATP7A gene mutation you see in Menkes disease. Very good, Paras, Stephen, Satvik. Very good, Shubhangi. So that's what. So GABRA1 gene mutation you see in juvenile myoclonic epilepsy. ATP7B, Wilson, ATP7A, Menkes disease. Very good, Shubhangi. Very good, Sandhu, Stephen. And ABCC2 gene mutation is seen Dubin-Johnson syndrome. ABCC2, that's important. ABCC2, you seen Dubin-Johnson syndrome. Remember Dubin-Johnson syndrome and Rotard syndrome? Yes or no? Any idea? Dubin-Johnson syndrome, does it causes unconjugated hyperbilirubinemia or conjugated hyperbilirubinemia? Anyone? Does Dubin-Johnson causes conjugate hyperbilirubinemia or unconjugated? So D for Dubin-Johnson, D for dark liver appearance. D for Dubin-Johnson, D for dark liver appearance. In the Dubin-Johnson syndrome, the UGT enzyme is very well working. The UGT enzyme is very well functioning. What is this UGT enzyme? So UGT enzyme converts the unconjugate bilirubin into the conjugate bilirubin. In the Dubin-Johnson syndrome, UGT enzyme is very well working. So unconjugate bilirubin is getting converted into conjugate bilirubin, but it is not able to get excreted. It is not able to get excreted. That is why you see conjugate hyperbilirubinemia. Very good. Lalan is right. Stephen is also very right. And drug of choice is nothing but valproate. Drug of choice is, what is the drug of choice? Sodium valproate. Sodium valproate is the drug of choice. Okay. Okay. Now this is a good question. If I am a girl and menstruating, then what will you give me? I'll repeat again. Normally, in juvenile myoclonic epilepsy, the drug of choice is valproate. But I am a girl of juvenile myoclonic epilepsy, but I am menstruating. I am menstruating. Will you give me a same sodium valproate only? Or will you give me anything else? That's a super speciality question. So always remember in this case, topiramate, because topiramate is good drug of choice, because as I am menstruating and sodium valproate is teratogenic also. So you don't give sodium valproate to the a woman, and because that's teratogenic, so in that case topiramate is a drug of choice. Okay, next, what are this sign? Where do you see this sign? Is a very easy one. In these all things, where do you see Wimberger sign, white line of Frankel, Pelkin's fracture? Where do you see all these conditions? In all these conditions, you all know that we see only in one thing, that is nothing but scurvy. Yes or no? In a case of scurvy, the patient comes with pseudo paralysis and pain and gum bleeding and everything. Not gum bleeding, but periosteal hemorrhages and everything. So this is nothing but our scurvy. Next, okay. If I say this is a nothing but Keshan disease, a patient of Keshan disease. So Keshan disease is deficiency of what? Any idea? Stephen, Lallan, Satvik, Sandhu. Keshan disease. Keshan disease is because of deficiency of dash, and most common congenital heart in Keshan diseases. Anyone? Yes, exactly. So Keshan disease is nothing but deficiency of selenium. Deficiency of selenium is seen in Keshan disease, and most common congenital heart in Keshan disease is dilated cardiomyopathy. DCMP, dilated cardiomyopathy, and deficiency of selenium you see in Keshan disease. Very good, Hemal. Very good. Done, done, done. And you see a garlicky order. Remember, you see a garlicky order in Keshan disease. Okay. Okay, what is the triad of yellow nail syndrome? What is the triad of yellow nail syndrome? It was recently FMG question, yellow nail syndrome. I'll show you a picture. Okay, yellow nail syndrome. Number one, what can you see here? Can you see edema, pitting edema? So no, you please write edema. Point number one. The question is, what is the triad of the yellow nail syndrome? So triad is nothing but lymphedema, respiratory manifestation, and discolored nails. I'll repeat again, respiratory manifestations. I'll write here. This is the respiratory system, right? Respiratory issues, respiratory manifestations. Number one, edema, like a lymph edema. And do you see like yellow nails? Like clubbing is not there, discolored nails. I would say discolored. Discolored nails. Yeah, that's very true. Satvik is very right, Satvik dear. So, yellow nail syndrome, the triad is very important. Lymphedema, respiratory issues, and also at the same time, discolored nail. But you don't see clubbing. Do you see clubbing? No, you don't see clubbing in yellow nail syndrome. Okay, this is also very good, very nice syndrome. uh Three pictures are there, you need to tell me the best diagnosis. Anyone? Three pictures are there. Number one, this is the case, like first picture is sinusitis. Second picture is azoospermia. Anyone? So you have, most importantly, sinusitis, you have azoospermia, and very important, this what you call bronchiectasis. It's an x-ray of bronchiectasis. So anyone, where do you see sinusitis, bronchiectasis, and azoospermia? Do you see azoospermia in Carter syndrome? Anyone? Sperm का photo है ना वो, तो azoospermia. So the answer is very importantly young syndrome. Young syndrome. Young syndrome. Remember, if it was a Carter syndrome, then number one, of course, chronic sinusitis, yes, is there in Carter. Yes, second, there is bronchiectasis, that is also there. But with chronic sinusitis and bronchiectasis, you see situs inversus. So I'll repeat again. In Carter syndrome, you see chronic sinusitis, bronchiectasis, and situs inversus. Situs inversus means the heart is on the other side, like a dextrocardia. And in young syndrome, you don't see situs inversus. Instead of situs inversus, you see azoospermia or infertility. Azoospermia. Has everyone understood this much? Cystic fibrosis patient will come to you. Most important, mother while kissing her child found her child's skin salty tasting. So salty tasting skin, that you see in cystic fibrosis. Done. Very good. Okay, Alport syndrome. Alport syndrome again was a FMG question also and a NEET PG question also. Alport syndrome has a triad. Again, show you a picture. Okay, what is this? This is the ear diagram, right? So sensory neural hearing loss. Okay, what is this? This eyes में बहुत important findings. There's something known as lenticonus. Lenticonus. The triad of the Alport syndrome is nothing but, can you see SNHL? So most importantly, it's a ear picture. So sensory neural hearing loss. It's a kidney issue. Kidney, nothing but very important, hematuria and anterior lenticonus. So yeah, salty baby. That's very true, Santu. You're very right. Okay, so sensory neural hearing loss, anterior lenticonus and hematuria. What is lenticonus, anyone? मतलब क्या होता है lenticonus का? मतलब cone shape. And lenticonus. Conus means cone shape. Cone shape, very important. Cone shape. What do you call it? Cone shape deformation of the anterior or posterior lens surface. So cone shape, we have anterior lens or posterior lens. Cone shape, that is anterior lenticonus. Okay, that you should know. Or yeah, that's it. You see anterior lenticonus, cataract, macular changes, and hematuria. Hematuria is very important. Very true. True. Last question. Okay, then we are going to finish the class. So which is the most commonest cause of congenital hypothyroidism? Last question, then this class is over. Anyone? Which is the most commonest cause of hypothyroid not working? Okay, most importantly, the most commonest cause of hypo in thyroid hypothyroidism is nothing but thyroid dysgenesis. Thyroid बना ही नहीं है ही नहीं, तो वो बनेगा नहीं, है ही नहीं तो बनेगा नहीं. The most common cause of the congenital hypothyroidism is thyroid dysgenesis. The second most common cause is dysharmonogenesis. Dysharmonogenesis. Okay, these are the two important things you should know. The most common cause of thyroid not forming is thyroid means congenital hypothyroidism. The most commonest cause is thyroid dysgenesis, or second most commonest is dysharmonogenesis. Okay, and acquired causes, my thyroid is not working. Acquired causes could be autoimmune hepatitis. Okay, so thyroid bana hi nahi hai. There is thyroid dysgenesis. Like thyroid is not formed at all. So T4 will be low and TSH will be high in a case of compensatory mechanism in thyroid dysgenesis, and goiter is absent. Whereas hormone, so that's what. So in this case, goiter will be present. In this case, in thyroid dysgenesis, goiter is absent, and this hormonogenesis, that goiter is present. That you should. Done. Okay, yeah. And last question, what is this? It's nothing but boot shape heart. It's nothing but boot shape heart. And where do you see boot shape heart? Boot shape heart, it is seen in our tetralogy of Fallot. boot-shaped heart. It is seen in tetralogy of Fallot. Okay, that finishes the whole thing. So we have covered very beautifully. We have covered a lot of questions. We covered tetralogy of Fallot. We covered this most common cause of hypothyroidism. Thank you so much. Thank you so much. And we covered a lot of pictures also. This is anterior lenticonus seen in Alport syndrome. Like this is our Young syndrome. Remember, Young syndrome is nothing but chronic sinusitis and bronchiectasis and azoospermia. Okay. Yellow nail, may remember clubbing is not there in yellow nail. Clubbing is not there. There is discoloration, there is edema, and there is respiratory manifestation. And Kesha disease is deficiency of selenium. White line of Frankel is seen in scurvy. Okay. And remember, juvenile myoclonic epilepsy (JMA) patient will have twitching of fingers and dropping of objects. Twitching of fingers and dropping of objects. That's how the question comes in. Okay. That's it, I guess that's it. Thank you so much. Thank you so much for the lovely 1 hour video. The next video is at 5:10. After 40 minutes, we have another session of the class, and then in there we have a test of the milestones. We have a grand test today of the milestones on our Unacademy app, on our special class. So if you're a newcomer, please join Unacademy and you can continue watching the milestones grand test class there. Okay, at 5:10. Thank you so much. Thank you so much, Stephens. Thank you so much, Satvik, Hemal, Sandhu. Thank you so much for the wonderful